Welcome to today's session of the Impact Mission. As open fences in our ecosystem work, we've been working with the counties to figure out how to bridge the public and private sector collaborations. There's a concept that Open Fences has come up with that marries what the Dutch are doing with the key needs of the counties and putting all this together to get a program going.
Ginoa means hope, and that's why it's hope for the first 1,000 days. And really, this is trying to ensure that all our babies have the best start in life. So when we're thinking about the care of the baby and the care of the mother, we think about the social obstetrics of the mother, particularly for vulnerable mothers. And in our setting, these are mostly teenage mothers or mothers who have pre-existing conditions or conditions that come because of pregnancy.
We're almost designing a county health service around the first 1,000 days. And it's possible to design something that then triggers changes in other aspects of care, including care for adults, including care for other people, because it's very well organized, and the way the investment is coming is actually working in a very concerted way.
40% of the care actually occurs in private hospitals. And so it is our role to onboard the private hospitals to ensure that they are actually at par. And so it is our role to onboard the private hospitals to ensure that they are actually at par. But there lies the challenge on how do we incorporate private hospitals to work within the legal frameworks. We are doing an experiment in Kisumu, what we are calling Safe Mama Tech, where we have public facilities working with private facilities, public. So this kind of a premise, and of course we have to do an MOU, is where we need to move towards, where it is the whole health system, the whole health ecosystem, private and public, working together.
Digital Superhighway, how are we looking at it, the health financing lens, is an enabler that we want to see that more data we have, then the more we are likely to make decisions around where to put the money in, but not only where to put the money, but also just to try and create incentives around how we finance. Are we just going to finance inputs, or are there opportunities for us to finance outputs as well, or outcomes? But that can only be answered if we have enough data and system to support that, because right now it's hard to say we can pay for results because we don't have digital systems to do that.
Primary healthcare in this country is reliant on money from National Treasury. So the majority of county money, I mean county money for all functions, not just for health, comes from the exchequer allocation. If you bother yourself with only what is happening in the public, you're only taking care of 50% of the needs. But it's important to say that if you're going to operate in the healthcare space in Kenya, if you only work with public, you're working with 50%. If you work with public and private, then you're reaching more. But the private has a lot of money, yet covering very few people.
Now, we just completed a pilot study at Kisumu with our good friends at Kemery, and we wanted to understand what the burden of sexually transmitted infections are. And we can say that with great certainty that the study was a success, and that we are seeing a lot of unmet needs when it comes to STI services and diagnostics. So our framework is more so on improving maternal health care and also women and young adult health care when it comes to STIs and more so with diagnostics.
Yesterday we spoke with a lot of CEOs or founders of clinics, and what came out of their analysis was really they would like to be supported in their trainings. They need capacity building, especially at management level. They wanted more support on that level. So that's what we would like to bring to the mix, and is support to that enabling environment.
I want to see a framework that speaks to our context. A prof talked about a theory of change, I think. But from where I sit, I want to see what are our key results areas and how are they linked to our indicators. I think to the SDGs, because at the end of the day, as a global community, we're talking about SDGs. Okay, so once we identify these key result areas, what are some key investment opportunities in these areas, or key initiatives, which might translate into investments that we need to take? What are their opportunities for catalytic funding?
COG works with development partners, and our heavy investors in COG are basically partners. And the partners actually who have worked with county government or COG have seen the results. The visibility is out there. And as COG, anything that actually happens through our coordination is documented, and it's documented at the Marifa platform. And I'll encourage you also to come on board, work with us. We can be able to give you access to the county government. We can be able to document your stories. We can be able to tell you what partners are doing in the counties. We need to coordinate the partners, work together. Even with the little resources that you have, you can be able to maximize the input.